This week's edition of NJBIA's Minding Your Business is brought to you in part by AT&T, helping family, friends, and neighbors connect in meaningful ways every day. From the first phone call 140 years ago to mobile video streaming today, AT&T innovates to improve lives. And by New Jersey Business Magazine, providing the critical information needs for New Jersey's business community for more than 65 years.
Welcome to NJBIA's Minding Your Business. I'm your host, Bob Considine. Well, Governor Murphy recently signed a new environmental justice law designed to protect overburdened communities in New Jersey. But how will it impact businesses and jobs in the state? Here to tell us all about it is NJBIA Vice President of Government Affairs, Ray Cantor. Ray, thank you so much for being here.
It's a pleasure, Bob.
Thank you. So just tell us about this legislation. What does it mean for New Jersey?
Well, this is a unique law. It's never been adopted anywhere else in the nation. And essentially what it does is it establishes a new process for looking at environmental permits for a number of facilities in what they call, overburdened communities. It creates, standards that have never been, enacted anywhere else in the nation. It requires that before you get your environmental permits, and we're talking about a wide range of different permits, you have to do a cumulative impact analysis. You have to have a public hearing and listen to the community, which is a good thing, by the way.
Right.
But then it sets up a standard at the end in order to get your permit, and it says that if the stressors in the area where you're going to locate your facility are higher than stressors in other areas of the state, then they must turn you down. Or for certain expansions or renewals, they can impose conditions. And there are a lot of concerns with how this is going to play out.
Okay, so what kind of facilities are we talking about? Like manufacturing places?
Well, absolutely. Well, first of all, it applies to like 8 different categories. Some of them are solid waste facilities, recycling facilities, wastewater facilities, things which are really essential for society to operate. But also it has a definition including major air facilities. And those facilities include, there are about 250 some of these facilities in the state right now. And they include most of our major manufacturers, but they also include other facilities such as large hotels, universities, because if you have a large boiler and you're heating a large building, you fall under that, and now you have a whole new set of conditions that you have to comply with that you've never complied with before.
Okay, so the intent of this law, and it seems well intended, is to protect overburdened communities. What is an overburdened community exactly?
Well, first of all, that's a great question, because most times when we think about environmental justice, we think about dense urban areas where they may have historic contamination, but this is a very broad definition that does not define overburdened community in the context of environmental impacts. It defines it based on the racial component of the area, whether or not the people there speak English or another language, and also on the economics. The way it's defined, it applies to a large swath of the state. Over 300 municipalities, all or in part, are under this legislation. And if you add up the total population of all these areas, it's 4.5 million people. So about 2/3 of the state are now going to be considered to be in the overburdened community.
So we're, you said 300 municipalities. There's 565 municipalities in the state, so it's more than half from even a municipality standpoint.
Correct.
Wow. Our legislators have talked about the importance of cleaning the air and things like that. How badly do we need to improve the conditions? What progress has already been made?
Again, an excellent question. There's no doubt, New Jersey is an old industrial state. We have an old manufacturing base. We have a lot of, abandoned sites, a lot of contaminated sites. And a lot of those sites are located, in urban areas where factory towns grew up and people moved around those factories. Over time, they became, abandoned and the older environmental standards were not anywhere near where we are today. So a lot of problems were created and need to be addressed. But we've made tremendous progress. In the last 10 years alone, over 10,000 contaminated sites, many in these areas, have been cleaned up. We are now in compliance with what is called PM 2.5, particulate matter 2.5, right. Which are the small particles in the air that could cause, asthma. We're in compliance with federal standards. We've changed our bus fleets, over, from diesel or to cleaner diesel, and we invested like $30 million to do that over the last decade as well. So we've made tremendous progress. More needs to be done, but again, the business community and the state have stepped up over the last several decades, and we now have the most stringent environmental standards, and we're getting better every day.
Right. So what are permit applicants, what do they now have to do under this new law?
And that's part of the problem. This bill, again, I said it's the first of its kind in the nation, and there's a reason really why no one's ever taken this step before. It creates very vague standards. It uses terminology such as cumulative impact and disproportionate impact. DEP right now has very good standards. If you have a water discharge, you could set standards and say you can only discharge this amount of pollutants in order to maintain the integrity of that water body. Right. You have very clear standards, very strict standards on air permits, where you could look even at a community level and say, here are your standards, here's what you need to meet in order to make sure that the people's health is protected. What this bill does for the first time really ever is say you must now compare or add together somehow the air, the water, contaminated sites, people's existing health conditions that may be in areas, their underlying conditions, and somehow do an assessment of what this all means to a community. While it sounds good in theory, in reality, there are no scientific standards to do such an analysis. And we're very concerned that at the end of the day, businesses aren't going to know what to meet. When you get an environmental permit right now, and this has been the history of environmental protection for the last 50 years, the scientists determine what is safe, they set standards, and industry knows, here are the standards I need to meet. Right now, under this new law, there are no standards. There are just vague concepts, and it's going to create tremendous uncertainty.
So I just want to make sure I hear this right. Is it up for the permit applicant to come up with these cumulative impacts, or does DEP determine it?
Again, it's very uncertain. The law doesn't specify that.
Okay.
The law says you must do a cumulative impact analysis. It then says you must go to a public hearing process, which is good, and involve the community. Again, things which we support. And then at the end of the day, they take all that information, and they're going to compare, presumably, the overall stressors in areas like Newark and Camden, and compare it to other areas of the state, which could be Hunterdon County or Sussex County. And if Newark has more stressors than Hunterdon, then they're required to say no.
Right.
Again, it's a process. It sounds good on paper.
Right.
It doesn't work in the real world.
It's almost sounds like you're forcing an apples and orange situation and just converting it to apples based on the location.
No, absolutely, and we think it's a standard that really can't be met, and that's why we have concerns, and we especially have concerns when we're talking about existing facilities.
So how is this going to impact manufacturers in the state, both ones that are already here and already have permits, and also manufacturers who might think about coming to New Jersey to open up shop?
Right, and those are really two different categories. The law treats them slightly different, but really the impacts are going to be tremendous, on both avenues. When a facility or a company is looking to locate a facility and they're looking at New Jersey versus Delaware versus Tennessee, they're going to look to see what the costs are, what their compliance requirements are to come to that state. Under this law, you don't know what standards you need to meet. You don't know once you begin that process if the answer will be yes or not. You can't go to your engineers and say, here are the standards, can we meet that? Here we're left with an analysis of comparing different sites to other sites, which we don't even know what those are. Right. So it's going to scare off businesses from even trying to locate here. And if you're already here, right, and you're looking to expand, often facilities, similar companies, they have facilities in multiple states. And they're going to look to say, should we expand in New Jersey or should we expand in Delaware? And they're going to say, well, we know what we have to do in Delaware. We don't know what we're going to do in New Jersey. They'll just go to Delaware.
Right.
And even more problematic are existing facilities. Again, I mentioned there are about 250 major air source facilities, in the state of New Jersey right now. They have invested tens of millions, in some cases even hundreds of millions of dollars. They've met the most stringent, air permit standards, in the nation. And now they're being told when you come up for renewal in 5 years, all air permits need to be renewed, in 5 years. You're going to have to go through a new process that's never been, done before, with standards that are not, prescribed, and you may be told that you may need to stop operating. You may be told that you need to cut back certain, of your hours. Right. We know a lot of advocates, have targeted facilities and they want them closed or significantly shut down. It's fundamentally unfair to take an existing facility that has been a good neighbor, providing great jobs, high-paying jobs, right, in New Jersey, and now subjecting them to a process that's undefined and can effectively close them down. You're not going to be able to get financing for these facilities, even to expand. No one's going to want to give you money to expand the facility if in 5 years from now you can't guarantee you're still going to be in business.
So what are the next steps, if any, now that this has become law? Obviously, you still want those truly overburdened communities to be protected. But for business, what's the next recourse? Well,
and absolutely, again, we talked about the environmental progress that has already been made, and we were very much in favor of when these major facilities, are in, overburdened communities or in any community. We want them to be good neighbors, and we want them to employ the best environmental protections and do other things even beyond that, to help, their areas. We've been very active, or we were very active in the legislative process before this bill became law. And even after it was signed, but before the governor, signed it, after it was passed before the governor signed it, we actually met with leadership of the Department of Environmental Protection, right, to talk about our concerns and what their plans are. We had a very good dialogue with them. We'll see how that plays out. But DEP is going to have a stakeholder process, I believe, beginning next month.
Okay.
And we're going to be actively involved. We've been working with a coalition of other business groups and a number of our members. And we're going to make sure that DEP hears our concerns. We're going to help them understand what the issues are and hopefully have regulations that make this bill workable. Right now, as drafted, we have real concerns. It's going to have a major impact on businesses, especially manufacturers in the state. We need to make this work.
All right. Well, Ray Cantor, Vice President of Government Affairs for NJBIA, specializing in environment and energy. We definitely appreciate you being here, and keep us posted as we go forward with this.
Absolutely, Bob. I will.
Thank you. Well, if you see anyone logging their minutes as they walk, jog, bike, or hike this weekend, they may be taking part in an important charity event by Bristol-Myers Squibb. Here to tell us all about it is Catherine Owen, Senior Vice President and Head of Major Markets at BMS. Catherine, thank you very much for being here. What can you tell us about this Move for Minutes event put together by Bristol-Myers Squibb?
Well, thank you, Bob. So with all the ways that COVID-19 divides us right now, Bristol-Myers Squibb was looking for one way to unite all of its global employees around a great cause. And with the fact that we've just merged Celgene and Bristol-Myers, two great New Jersey companies, into one, right, we were looking for an event that would unify everybody. And so we've chosen to support two great charities, the American Red Cross and the International Federation for Red Cross and Red Crescent Societies, right, in a charity event where our employees are being asked to move for minutes. So they can choose whether they bike, hike, jog, or even walk, right, talk for charity, or do anything that requires them to move over a period of time. And it's a period of 4 days. And during that time, they're going to log their minutes. And at the end of it, we're going to see how many minutes that they've achieved. Right. And we're looking to donate up to $1 million to our charities, right, across that 4-day event.
So the 4-day event is October 1st to the 4th. I believe I have that correct. How will the minutes that are involved by all these people, how are they going to be logged?
Yeah, so great question. So around the world, everybody will be asked to log their minutes at the end of every day through a Survey Monkey or an app.
Right.
And at the end of the 4 days, we're going to tabulate them all up and see how many minutes people have actively been contributing to their communities.
That's unbelievable.
And we're going to total it all up, and at the end we're hoping to beat 1 million minutes, and if we achieve 1 million minutes, Bristol-Myers will donate $1 million to our charities.
Wow. So people got to get a move on here.
They've got to get moving.
And this is part of, I guess, called Global Patient Week. What is that?
So Global Patient Week is an annual event that BMS has held for a number of years. And it's a time where we take a week out of our busy schedules to really think about the patients that we serve as a company. Our patients are the core to our mission. And what we try and do for our global employee base is bring their stories to life. So we invite them into our headquarters in Princeton Pike. We invite them into many of our offices around the world, and they share their stories with our employees. We have videos, we have interviews with their families. And we really look to understand the journeys that they take through their various different diseases. And we learn about the impact that our innovative medicines have on their lives.
Right.
And so it's a really powerful event. And this Move for Minutes will be the cornerstone of our 2020 event.
You know, I, as you were talking, I recall seeing some of the videos that you're speaking of. Well, there was a patient with lupus that I found really touching, and there's some great content on there. Suggest you check it out. Why is it important for BMS for community to assist these groups, the Red Cross and the International?
Yeah, the International Red Cross.
Why this year for these groups?
Yeah, no, why this year? Great question. I think the biggest event, obviously, we've all been through this year is the global pandemic and COVID-19. And as in my job as the head of major markets, I'm learning about all the different ways that COVID's impacting our communities around the world, as well as the community I live in here in New Jersey. And so it was important for BMS to acknowledge the stresses and the strains that our communities are under, and to support a charity that's actually helping our communities get through COVID-19.
Right.
And we felt that the American Red Cross and the Red Cross Society internationally was a perfect choice, because they really focus on supporting communities, helping patients access medical care, and actually, really importantly, blood supply.
Right.
So the International Red Cross is really pivotal in ensuring that blood supply gets through to the right patients during this difficult time.
Right.
So we felt it was a perfect match of our focus on volunteering and our efforts to really unite around COVID-19 and give back.
Right. Is this the first time that this program is taking place, Move for Minutes?
It is. It's the first time, and so it's a unique event, and it's really inspired a lot of internal excitement,
Right.
Especially because we don't have to just choose one thing. You know, I'm not very active, I'm going to be honest, but I'm going to walk my Labradoodle dogs.
That's right. I think we have a picture of them.
I do, yeah, that's Alfie and Brady. But I've got colleagues that are doing kayaking, colleagues that are hiking up mountains, colleagues that are giving back to the community through our Skills for Charity program, where they can actually give an hour of their time.
Right.
And so there's a million different ways, and we're hoping for that million minutes.
So this begs the question: if you're going to be walking your dogs,
Yeah.
for moving for minutes, do you count their movement as well?
You know, I really should think hard about that, but I'm going to have my husband and my 2 daughters with me, so I'm going to hopefully multiply it by 4, because there are 4 of us moving.
Well, I'm thinking that, you know, we always do things in dog years. You know, a dog is 7 years. Are they getting 7 times their minutes just by walking? I mean,
I'll think about that.
the possibilities are virtually endless.
They are
with this.
endless, exactly.
I would like to tell you, just if you could explain some of the what this means for BMS to both their employees and the people, the patients. What kind of feedback do you get that they have this opportunity to take part in this?
So first of all, you know, we're all so far apart right now, and we're feeling very disconnected.
Right.
So this is one way that helps bring us together. And we have an international company and an international focus, but we're all very local within our communities, and people love to give back to their local communities. So we have an internal social media channel. It's a Yammer channel. It's a little bit like an internal Facebook. And already people are posting what they're going to do. They're inviting people to participate with their local event. They're really encouraged to share what they're doing and get the excitement going, so that when we hit October the 1st, everybody has the chance to be involved. And it's got an amazing amount of energy so far. And I'm really excited to see what different things people do. It's been really, really encouraging.
All right. And Catherine, one last thing in closing, is there a way people can get involved? Is there a place they can go to get involved?
So this is just for BMS employees and our
Okay.
patients,
Okay.
but I think it's a great call out, Bob, that the International Red Cross and the American Red Cross are always in need of local giving and local charities, and all of our local charities are crying out for help right now. So as many as we can locally, I would just encourage us all to reach out to our local communities and see how we can help.
All right. Well, Catherine Owen, Bristol-Myers Squibb, I think you just celebrated your first anniversary with the company.
I did, yeah.
Congratulations.
Thank you.
They should be very proud and happy to have you.
Thank you so
Come
much.
back anytime.
Thank you so much for having us.
Okay. And we'll be right back after this.
These days, it's anything but business as usual. That's why working together is more important than ever. AT&T is committed to keeping you connected so you can keep your patients cared for, your customers served, your students inspired, and your employees closer than ever. Our network is resilient. Our people are strong. Our job is to keep your business connected. It's what we've always done. It's what we'll always do.
During an emergency, a network becomes a critical line of communication, connecting first responders to technology and to each other. FirstNet is the only officially authorized wireless network built with and for first responders. It's highly secure, eliminates throttling, and cuts through the clutter of commercial traffic. It's the help you need to help the people who need you.
Welcome back to NJBIA's Minding Your Business. I'm Bob Considine. Well, it's time to honor another one of NJBIA's New Good Neighbor Award winners. This time around, we're going to take a look at the Hackensack Meridian School of Medicine, which transformed a historic pharmaceutical building into a state-of-the-art facility. Let's take a look.
The Hackensack Meridian School of Medicine is a new medical school. In fact, it is the first private medical school in the state of New Jersey in nearly 50 years. The Roche building is a building that's filled with history, and we're very excited about this stage in the history of this building. The outside is left relatively untouched except for the signs that tell us who's here. But the inside has been totally revamped in order to welcome the teaching of a 21st century School of Medicine. We have a magnificent studio for standardized patients and for mannequins, so that by the time our students actually go to the hospital wards, they are able to be very competent hands-on clinicians already. We have a wonderful anatomy lab that again is state-of-the-art, and we're connected by a bridge to a very, very powerful and forward-thinking research facility. Well, our overarching vision is that every person in New Jersey will have the same access to health and well-being regardless of race or socioeconomic status. It's wonderful to start a new medical school because when you do that, you can build every aspect of that school on your vision, which then means it's much more likely you're going to be able to achieve it.
All right, great work there from the Hackensack Meridian School of Medicine. And speaking of all things health, it is now the early part of fall, and for many business owners, that means open enrollment for health insurance. NJBIA is a health benefit plan program now entering its third year that brings savings to its members. And here to tell us all about it is NJBIA Chief Business Relations Officer, Wayne Staub. Wayne, we've waited for you so long for you to join us on this show. It is one of the highlights of my life that you are here right now.
Well, thanks, Bob. It's great to be here with you today. Really.
So what can you tell us about the health benefits plans that NJBIA offers for small business?
So really excited about this, and hundreds of our members have taken advantage of this over the last 3 years, including ourselves as an association providing it to our employees. The choices that you have really make it more competitive. There are over 156 plan designs. That alone gives businesses the opportunity to shop for a product that is right for them and for their employees, many times creating a lot of savings for our members.
Right. How's NJBIA able to secure these self-funded health plans?
So we were able to partner with an existing organization called Association Member Trust.
Member Trust.
They just rebrand it, and it really is a true reflection of who they are, because they all are about the members, which we're very happy about because we're all about our members. We not only provide this service to the businesses, but we ourselves as an organization utilize it for our employees. We've been very happy with it. Being part of this trust allows us to pool resources together to expand programs and services and to provide more options than most other plans out there.
Right. And essentially what we're talking about is a MIWA, right? It's a multiple employer welfare agreement.
Yes, sir.
Can you explain that to our viewers, what that is?
So basically that is the band of these 16 associations banding together to provide buying power and purchasing power to lower premiums and costs. They are a nonprofit company as well, and it's been around since 1979, but they took over the association, which was started in 1949. So their financials are secure. When applicable, they do pay dividends back to the policyholders, which is a big part of this. Again, providing choice, providing customer service, and providing dividends back when applicable.
What kind of feedback do you get from other members about these plans?
Well, you know, again, it has been all over the place as far as how much savings. We've literally had emails from members telling us that this saved them, their business. You know, healthcare is very personal, and you only need it when you need it. And when you do need it, you want to be able to be secure that you have somebody in your corner. And that is the beauty of, part of the beauty of association member trust. Myself included, when we had some issues on the billing side, we were able to work through association member trust as opposed to navigating the Horizon Blue Cross Blue Shield network. We were able to speak to the same person time after time until we got it rectified. So we've had members who have saved tons of money. We've had members who have expanded the health program offerings for their members and still save money. And we've also had members who may not have been able to save money, but have significantly increased the value of what they're offering their employees.
That's a big deal.
And in a tight labor market like we have, you know, providing these benefits are critical for employers for attraction and retention.
Right, and I would say to our viewers, you know, NJBIA does a business outlook survey every year, and one of the things that always comes back to us is the biggest concern of business owners is providing health care for their employees and able to afford it. So this is a great opportunity for them.
Yeah, you know, like you said, and we hear the same thing as we're out there. And you know, you mentioned health insurance or health benefit plans. Small businesses, mid-sized businesses, they want to talk to you because there's you know, a lot of costs associated with it. And again, providing the service that you want for when your employees or you yourself as a business owner need them to have it reliable and there for you. You can't put a price tag on that.
Right. And I mentioned at the onset that open enrollment season is typically now, but you can kind of enroll all year, correct?
That is correct, Bob. Most companies do tend to look at this at the beginning of the year so that they have their fiscal house in order at the beginning of January. But we have members who join every month of the year when they are able to look at some of the savings and costs and services that are provided through Association Master Trust.
Members Trust. I got you. I got them. Hey, it's been Associated Master Trust for decades. You're allowed. You're allowed to make the error.
Thanks, Bob.
And Wayne, how do member businesses get involved?
So the easiest way is to go to our website, which is www.njbia.org. We have a cost calculator on our website, which will give you the opportunity to input some information, not only about healthcare, but about 3 other member benefits that we offer. And it should be able to give you some savings, show you the savings you can have right there. Healthcare could be a little tricky, particularly because of all the choices and options that you have, but we have resources that will direct you to the appropriate people at Association Member Trust to get you a quote and get everything moving for you.
Right. And that calculator Wayne mentioned, with every pun intended, you could definitely count on it. It's a great tool. Wayne, Mr. October, Wayne Staub, thank you for being here, and come back anytime.
Thanks for having me, Bob, and super excited to be part of this show, and super excited for our members to give this opportunity for them to save members money and to provide services for them.
Great, thank you, Wayne.
Thank you.
And thank you all for joining us. We'll see you next time on NJBIA's Minding Your Business.